This afternoon, I want to talk about our contingency planning, which includes our mobile medical unit plan, as well as progress being made to increase our contact tracing teams. As part of our contingency planning, we have developed plans to create low acuity inpatient mobile medical units in both Calgary and Edmonton. While there is not a current need, it is clear that Alberta's healthcare system is under significant stress given the increasing numbers of COVID-19 cases in the province, and AHS must prepare for all scenarios. This plan is part of our ongoing, proactive pandemic response planning and is one of several initiatives that will ensure our healthcare system can meet increased demand caused by COVID-19. We are also trying to maintain a balance of continuing to provide non-COVID related care to Albertans. Throughout our response to the COVID-19 pandemic, AHS has proactively planned for all scenarios, ensured we have access to all resources available, both within and external to the organization. Additional beds in a mobile medical unit would be used for low acuity patients or vulnerable populations who need low acuity health care. These may be patients who are stable and on the road to recovery, but aren't quite ready to be discharged home. Having these mobile units would help reduce demand on our in-hospital acute care beds and teams. No formal agreements have been made. However, we are in discussions with several external organizations to identify potential partnerships. Staffing these mobile units will be a challenge, and planning work is underway on potential staffing models. And while promise of a vaccine is a light at the end of the tunnel, staffing remains to be a challenge, and we will continue to look at ways to deploy our staff. For example, in partnership with the College of Physicians and Surgeons of Alberta, we have relaunched the college's COVID-19 physician registry, which enables physicians to enter their current availability to provide care as part of our response to COVID-19, and their willingness to be contacted by AHS for COVID-19 redeployment opportunities if needed. This mirrors a very similar approach that we took in the spring. Provincially, there are approximately 8,800 out of 11,000 physicians who have responded to this request for redeployment. Physician redeployment will be based on service priorities determined through a consistent, province-wide approach that reflects the needs of patients in each zone. This will assist AHS's efforts to support temporary staffing changes, which will ensure the availability of physicians in areas of greatest need. We're also working extremely hard to bolster our contact tracing teams. As case numbers have increased exponentially in the past 6 weeks, it has become more and more difficult for our teams to keep up with demand. Added focus has been placed on increasing the number of contact tracers we have provincially. We are rapidly increasing our response to the unprecedented volume of COVID-19 cases in the province. We have continued to enhance our contact tracing teams to meet demand, and we have currently about 50 contact tracers pre-pandemic. We increased this to 5 times by July to 300 and more than doubled it again to September to 700. We now have more than 900 contact tracers in Alberta and are on track to double it once more, bringing us to over 1,800 contact tracers by the end of 2020. This means that we will have 36 contact tracers per 100,000 people, which will be on par or better compared to other provinces.